Let's start by understanding how our coronary arteries are damaged. Here you can see that the first step of coronary artery disease is damage to the inner lining of our blood vessels, the endothelial cells. When the endothelial cells are damaged, LDL, or bad cholesterol, with inflammation leads to plaque formation. When the endothelium is further damaged and the plaque ruptures, a clot is formed and people have a heart attack. Studies have shown that animal fat and other fats in quantities normally consumed in the American diet acutely damage endothelium. In one study, 10 healthy people had blood pressure cuffs compressing their arm for 5 minutes. Then an ultrasound made measurements of flow-mediated vasodilation in their artery. This graph shows the reduction in diameter that occurs after consuming 4 tablespoons of olive, soybean, or palm oil. All meals showed flow-mediated dilation decrease of 32% and postprandial increase of triglycerides of 27%, independent of type of oil or if given fresh or if given deep fried. This is likely due to the endothelium not producing as much substances like nitric oxide, which cause vasodilation.
What does nitric oxide do? 4 things. It is the most powerful vasodilator in the body. You run upstairs, the arteries to your heart dilate. You run upstairs, the arteries to your leg dilate. Now, what else does it do? It keeps the flow of blood like Teflon. Keeps it from getting sticky. And also, it inhibits inflammation in the artery wall. That wonderful nitric oxide protects your vessel from ever getting inflammation.
Dean Ornish's 5-year randomized controlled trial compared 2 groups of patients with severe atherosclerosis. He put patients on a very low-fat vegan diet consisting of fruits, vegetables, unrefined carbohydrates, and legumes. Those patients on this diet experienced a 2.5 times fewer cardiac events, 24-pound weight loss in 1 year, and not only prevented the progression, but they achieved reversal of atherosclerosis. This data illustrates progressive stenosis in the control group who followed the advice of their personal physicians in regard to diet. Their stenosis actually worsened by 27.7% over 5 years. Conversely, those on the low-fat vegan diet actually experienced an 8% improvement in their artery stenosis over 5 years. In a UCSF study by Dean Ornish, lifestyle changes altered gene expression. 31 patients were selected with a Gleason score of 6, a PSA less than 10 or less than 15 if the patient had a history of BPH. They were placed on a low-fat vegan diet, given stress management techniques, moderate exercise, and participated in psychosocial support groups. 3 months later, the patients physically had a statistically significant decrease in their BMI of 2.5 units, systolic blood pressure decreased by 9 units, LDL was decreased 28%, and their waist size was decreased 3 inches. Along with these external changes, the genetic studies showed 48 genes were upregulated and 453 genes were downregulated, including the RAS family oncogenes. Dr. Esselstyn at the Cleveland Clinic has also had great success in not only preventing coronary artery disease, but also in reversing it using a low-fat vegan diet. In his study, he selected 23 patients with coronary artery disease who had had 49 coronary events in the past 8 years and a mean cholesterol of 246. He placed them on a low-fat vegan diet and followed them for 12 years. Their total cholesterol dropped from 245 to a mean of 145, And of the 18 participants who continued on their diet, none had any future coronary events during the 12 years. Listen to him as he shares the results of his study.
Can you stop and reverse this disease? Yes, these angiograms were done in triplicate in the Cleveland Clinic Angiography Core Laboratory, reviewed by senior medical technicians who do this all day long for national medical trials. So when I tell you this is as small an improvement as your eye can see, I know it's accurate. 10% in this left anterior descending coronary artery, 10% improvement from here to here. Do not be confused by the dates. The dates are when the angiogram was done. As I'll show you shortly, it doesn't take that long to make it happen. Here we have a 20% improvement in the circumflex artery of this 58-year-old factory worker. And in a retired security guard, here is a 30% improvement in the right coronary artery from here to here. My patients with heart disease, I want them to understand that their artery is aflame. It's like a brush fire. Two things we do to stop this fire. One, we take away all the gasoline. We take away all the gasoline, all the oil, the dairy, the meat. And in my patients who have heart disease, I should say they do not get nuts and avocado. So what we also need is water on the fire. So somebody will tell me, what's the water on the fire? And I will say, the water on the fire is the green leafy vegetables. And they'll say, well, what? She said, well, you'd be proud of me, Dr. Esselstyn. I have a little bit of spinach at night. What? Think of a shower head. There are 50 openings. Somebody has a little bit of spinach. Okay, one of the 50 openings is a little bit of water coming out. I don't want that. I want an absolute flood. So when I say green leafy vegetables, especially when I'm starting with somebody, this is water on the fire, I want what? Bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula. Right. I don't want it just at supper time. We want to bathe, B-A-T-H-E, bathe that inflammation. We want to bathe that inflammation not just at supper. I want the fire to go out. I want it even alongside your oatmeal. I want some greens. I want it at lunch. I want it at supper. And I don't even have a fit at all if you wake up at midnight with the alarm and go downstairs and have a second helping. Because you're putting the fire out and I'm pleased and happy for you.
In summary, we have shown that diet can be a powerful source of good health for our patients. The trends show increased consumption of meat, dairy, and sugar. These trends also show increased obesity, diabetes, and heart disease. Reformers like Esselstyn, Bernard, Fraser, and Ornish show that solutions exist which not only prevent but also reverse disease. I believe as doctors we need to aspire to provide simple solutions when possible. We should spend time focusing on the root of the problem and with creativity inspire a culture of health.